Hello class, welcome to the Adult Medical ICU New Graduate Residency Program. My name is Brenda Pavlik-McGowan and I'm going to be your instructor. Just a little background on me, I've been a nurse for coming up on 34 years now, 27 of those years spent in critical care, starting in an adult surgical ICU where I worked my way up the clinical ladder to become an assistant nurse manager and then eventually a nurse manager on that unit. I then became the nurse manager of a brand new medical ICU that opened up in the fall of 2019, and fortunately we were able to do that because who knew that a few short months later we were going to be in the midst of a global pandemic and in desperate need of more ICU beds. I transitioned to the Center for Nursing Professional Development to become a nurse educator about a year ago. Some information about the program itself: the Adult Medical ICU Graduate Residency Program will run bi-weekly for a total of 12 classes during the 6-month ICU orientation period in the Adult Medical ICU. The purpose of this residency program is to provide all of you, as newly graduated MICU nurses, with the knowledge and the skills needed to provide quality care to our adult MICU patients. The program will address the adult MICU patients' unique needs, including commonly seen diagnoses involving the respiratory, cardiovascular, endocrine, neurological, and renal systems. We'll also cover sepsis, shock, as well as other relevant topics such as end-of-life issues, safe ICU patient handling, and safe administration of commonly used ICU medications. Today, I just want to give you a quick overview of one of the units of focus in the series, which is the assessment, management, and prevention of pressure injuries in the prone positioned MICU patient. The use of prone positioning, which is just literally flipping patients onto their stomachs for a recommended amount of time, has long been known and used as an effective intervention for patients in acute respiratory distress syndrome, or ARDS. It can help improve oxygenation and reduce the risk of mortality. We'd see it used sporadically prior to the pandemic for patients in ARDS, but it was considered one of those high-risk, low-volume interventions that would all leave us kind of scrambling on the unit to remember what the protocols were and things like that. Fast forward to the COVID-19 outbreak, and prone positioning becomes one of the standard treatment methods for patients who developed ARDS because of the virus, and suddenly we would have multiple patients ordered to be prone positioned on a daily basis. So we got really good at this really quickly. Some facts about prone positioning in ARDS patients are that studies have shown that up to 67% of patients with severe COVID-19 infection developed acute respiratory distress syndrome. When performed early enough, and that's kind of the key here, when prone positioning is performed early enough and in sufficient duration, prone positioning can improve the survival rates among patients with ARDS. When transitioning to the prone position, respiratory system compliance may remain unchanged, it may deteriorate, or it may improve. We just never know how patients are going to react to this intervention. Prone positioning usually is recommended for about 12 hours at a time, and patients receiving invasive mechanical ventilation are sedated and paralyzed. Let's talk about some of the advantages of prone positioning that we'll talk about within the class. Reduced risk of ventilator-induced lung injury is an advantage of prone positioning. There's more efficient gas exchange in the lungs with this position. So if you look at that graphic there on the right, it shows how in the supine position patient, the ventral alveoli of the lungs appears overdistended and the dorsal alveoli appear collapsed. Underneath that, for the prone position patient, the dorsal alveoli appear less collapsed and the ventral alveoli are not as distended. So with this position, there's more efficient drainage of secretions as well, just by gravity alone, and it can even actually be initiated before a patient is intubated and still spontaneously breathing. We used to have patients doing self-proning positions so that they could maybe avoid having to be intubated, sedated, paralyzed, and then in a prone position. Let's talk about some of the disadvantages of prone positioning that we'll be covering within the class. So it increases the risks of pressure injuries and endotracheal tube obstruction and/or unplanned extubations. With recommended positioning protocols, the risk of patients in the prone positioning develop pressuring injuries or losing their airway can definitely be lowered. The majority of the pressure injuries occur on the anterior surface of the body, which makes total sense. So you'll see pressure injury of the head, neck, pelvic regions due to how close the skin lies to those bony prominences of the cheeks and hips and the cartilage of the ears even. Facial and ocular edema associated with prolonged pressure on the skin increases the risk of ischemic lesions on the face and can cause devastating injuries that require plastic surgery later on in the patient's course of treatment. If you look at the gentleman's picture on the left-hand side there, you can see that he has experienced a pressure injury on his upper lip after being intubated and in the prone position, and this injury has actually eroded right down to his teeth. So pressure is placed on the shoulders, the chest, the knees, genitalia, and face, predisposing these areas not only to ulceration but also to nerve injuries. And persons with darker skin tones have a higher prevalence of pressure injuries, most likely as a direct result of the difficulty in detecting early changes in the skin because of those darker tones. We'll talk about nursing care and management. This is so important because nurses have the primary responsibility for positioning and monitoring these patients, so training is essential for them to acquire the necessary skills. Nurses need to understand the respiratory mechanism initiated by the prone position and the associated risk for pressure injuries, in addition to standard pressure injury prevention initiatives, because critically ill patients are already at increased risk for pressure injuries. However, the patients are typically not at the same risk if they're in the supine position. The risk for skin injury among these patients is so high, and prevention should be prioritized in the plan of nursing care. Patients should be placed in the prone position on a pressure-relieving, low air loss mattress. You can see that picture on the right-hand side. This is one that is used in our institution. Such a mattress can prevent pressure ulcers from developing on areas such as the face, breast, the chest, genitals, knees, and toes. Prone positioning a patient adds definitely to the nursing challenges and workload. Caring for these patients can take an entire village. The participation of a certified and specialized nurse with expertise in pressure injury prevention and skin preservation significantly reduces the odds of patients having pressure injuries develop when placed prone for prolonged periods of time. Some studies suggest a 97% lower incidence just involving those skin care specialists. Partnering with the respiratory therapist and the provider team becomes even more necessary with the prone position patient. Interdisciplinary care is required, especially during the maneuvering of getting the patient into that prone position and then the subsequent pressure ulcer prevention. We'll get into the details of maneuvering during our class together. We'll also look at this three-step preparation that can be done before a patient is prone position for the first time and any subsequent times. There's 3 steps to this. There's eye care, which involves cleaning the eyes with sterile water solution, administering some lubricant gel drops, closing the eye with a wound closure strip across the eyelids. We don't want to use eye patches because they could actually cause more orbital edema and compression. We need to perform careful oral hygiene and check that the endotracheal tube is well secured to guarantee adequate anchorage. We want to remove any of the commercial endotracheal tube holders in favor of just using tape to secure the endotracheal tube. The commercial tube holders can actually cause more pressure on the face. We want to assess the condition of the patient's skin beforehand and use hydrocolloid dressings to protect various anatomical points. You can see in the picture to the left there, they can be placed on the forehead, the cheekbones, the thorax, iliac crest, the knees, all to prevent pressure ulcers from occurring. And then down at the bottom, I know it's a little difficult to see because my picture is there, but the swimmer's position is the recommended position for not only for optimizing gas exchange but also for preventing pressure injury. The head is positioned so that the face looks towards the ventilator. The limbs are positioned with one arm raised at the same side of the body that the face is turned to. The positioned perpendicular particular to the eye line. The other arm is alongside the body, preventing abnormal extension or flexion of the shoulders and elbow. The position of both the head and the arm should be alternated every 2 hours, which is why it's called the swimmer's pose. It's having a certified wound and skincare nurse can educate not only the nurse but also the respiratory therapist in the consistent rotation of the patient's head from side to side every 1 to 2 hours to relieve any potential pressure. The feet should be maintained in dorsiflexion with the ankle at 90 degrees, and the toes should not touch the structure of the bed. Flex the leg slightly on the same side as the flexed elbow so that the patient's body weight is distributed over a wider area of the bed surface and directed away from the midline of the body. So that's just a really quick overview of what we'll be talking about in at least this unit of study for the series, but I look forward to seeing you all in class.